Good morning, everybody. Dr. Anita here, my Lund Family Chiropractic Center. You're riding in the car with the Chiro. So this morning, unfortunately, I have to attend a funeral. So I'm in the car, riding in the commuter traffic, heading to North Jersey. So when I was thinking this morning as I was getting ready for to go and get ready for work for later on this afternoon, what my topic was going to be, I thought about the different patients that came in this past week. And one of the prevailing things that came through my door this past week was this shooting electrical numbness tingling that goes down the shoulder into the arm and hand and into your fingertips, where you have trouble holding your coffee cup, or you're holding your cup and it drops, or you can't seem to manually pick up the pen, or when you're holding your pen, you're getting this tingling sensation into your fingertips, and it's extremely painful and burning. So I wanted to talk a little bit about what that's about. A lot of people believe that it's related to quote-unquote carpal tunnel. And it's interesting because a number of the people that are coming in with this challenge, they don't have occupations that would mimic a job that would indicate carpal tunnel syndrome. So many of them have gone the other path, meaning they've evaluated through the medical profession and they were given anti-inflammatories, or they were given muscle relaxants for the muscle tightness and spasm in their trap muscles. They were told to wear wrist guards, which helps temporarily, but it doesn't really do the job. And so it gave me an opportunity as a chiropractor, with their frustration, to explain to them a lot of these cases, not all, but a lot of these cases are not true carpal tunnel. They're actually coming from the lower nerves, the lower area of your cervical spine, C5, 6, and 7, that goes down your shoulder into your arms and hands. And if you don't go about identifying which segment or segments in the neck are actually creating the problem, you're just throwing darts at a wall instead of darts at a dartboard to try and hit the bullseye. So as a chiropractor, I want to hit the bullseye in these kind of issues. So when I do my chiropractic exam, I discover before the exam in the consultation that many of these folks have had a history of past motor vehicle accidents that they didn't think were very significant. And they were 10, 15, 20, even 30 years ago, where they were in a major motor vehicle accident, but quote unquote, all I did was break my clavicle, or all I did was fracture my elbow, and nothing else happened. And they never received any thorough evaluation of their spine and nervous system to see if there was any effect, as in whiplash. Or I had two this past week that said, yeah, they got whiplash, but they were fine. Well, when we did the remaining of our chiropractic evaluation and took some x-rays, we found that they had a complete reversal of the curve in their neck. We found that in one case, they had severe degenerative changes at their discs in their lower neck, because the lower neck is where the majority of the curve is in your neck. And when you reverse that curve over time with bone rubbing on bone, you start to get wear and tear, or what we call osteoarthritis or degenerative arthritis. And that affects the nerves coming out of that area of the spine, which happen to feed down your shoulder into your arm and hands. And one of the other side effects of that is a lot of these folks are having quote unquote normal headaches for 20 years. Well, I'm here to tell you that there's no such thing as a normal headache. Headaches aren't normal. Headaches are a symptom from the body telling you, hey, I'm not feeling so great, help me out, right? And another side effect that people don't give any credence to, besides the shooting electrical pain down the arm into the hands and fingers and numbness and tingling, is the fact that they have very decreased energy, meaning that they just don't feel energized on a regular basis. No matter, I had some people who exercise on a regular basis, but they're not sleeping. That this numbness is waking them up in the middle of the night, and they have to toss and turn, and they don't get restful sleep, and they wonder why. They're cranky with their family members. They're short-sighted with their kiddos. They are going off on their spouses.
Continue straight.
Sorry about that.
US
That's
9
my
North.
GPS.
Signs for New York, Lakewood.
And they are just miserable And they didn't know why all of a sudden these last 4 to 6 months they have been on edge.
Onto US 9
Sorry
North.
about that.
Signs for New York.
I don't know how to
Lakewood.
shut it off. On edge all the time. So I'm here to tell you as a chiropractor that if you had a spine that has had a whiplash mechanism
Continue
injury,
for 1 mile.
I wish she would shut up. That that you will have nerve interference in the spine at the lower area of the spine, C5, C6, C7, which goes down. Hey, Hayden. Hey, Kathy. Down into the arm, into the fingertips. That will give you the numbness and tingling and the sharp electrical shooting pain. But if you have that for a long enough period of time, it's going to decrease the energy to your body because you're always fighting muscle stress, muscle pain, and you're not sleeping well. So when you're not sleeping well, it's going to make you miserable. The beautiful thing is this, guys and gals. Chiropractic care can correct that problem in most cases if you don't have severe degenerative arthritis. Certainly, even if you have severe degenerative arthritis, I'm here to tell you as a chiropractor, we have tremendous success in correcting it. And if it's not severe, correcting it. If it is severe, we can manage it so that you're not symptomatic, and we can manage it so that your nervous system is working better than it has worked in probably 20 years, and we will stop that degenerative process from progressing any further. While we can't correct that curve and bring it back if there's arthritic changes, we can help you symptomatically have better mobility and allow your body to be its very best. So if you're suffering, or you know somebody who's suffering, they need to go see a chiropractor. If you live locally, you need to come see me because I'm the best. That's just the reality of it. If you don't live locally and you want to know who's a great chiropractor, message me and I'll find you amazing chiropractor where you live all over the world. The internet does offer us that ability to locate some great colleagues of mine all over the world. So we'll find you somebody to take care of you so that you no longer have to suffer. So again, we're talking about numbness, tingling down the arm into the hands, decreased energy, inability to sleep, chronic headaches that you think are normal are not. When your spine and nervous system is out of alignment, a chiropractor can locate that and most of the time correct it. If it's not correctable, we can manage it so that it doesn't continue to progressively get worse, so that you can be at your very best in spite of what's happened to your spine and nervous system, and then maintain it so that you never have to worry about feeling that crappy again.
Onto US 9
All right,
North.
let her talk. So my recommendation is call me. Let's get you set up. If you're not local, call me anyway. Let's find you somebody amazing to take care of you. You've been riding in the car with the Chiro. This is Dr. Anita. Please tell your friends and family members who that chiropractor is. And if you don't know, find me. I'll locate somebody for you. Have a fantastic day. I'll catch you on the next ride. This is Dr. Anita signing out. Have a great, fantastic day.